Stakeholder analysis. Parties who determine the success or failure of and are affected by the implementation of a new process are referred to as stakeholders. Stakeholders for the implementation of this new process include the developers of the BCMA system, managers, nurses, patients, the IT and education departments. The patients are considered stakeholders because they are receiving IV therapy and are the at-risk population for adverse events. The managers, IT, education, and BCMA developers will be required to work together successfully in order to implement the launch of the new workflow and gather feedback, data, as well as make necessary adjustments. Potential barriers and risks from stakeholders include pushback from nurses who are not willing to comply with the new workflow, managers who may be hesitant to implement the new workflow due to added steps, increased costs and time needed to train staff on the new workflow and purchase of the new product. There should not be barriers to implementation associated with the patient, IT, and education stakeholders. Actions to take which should reduce attitudes and barriers include educating patients on the new process and how it benefits them, providing nurses with education about how this will eventually save them time and can be an easier resource for passing medications, and educating managers of how this increases patient safety.